Hey everybody, Shane Class here with Shane Talks Politics. Well, it's only been a few hours since I posted my first video about the draconian measures that our Twin Falls School District Board of Trustees is putting out and mandating that our kids are going to have to wear masks. And there's been a tremendous amount of support. I am impressed, Twin Falls. There's a lot of you that have sent me positive messages and people that are asking, how can we get involved? What can we do to help? And but I already knew it was coming. You're so predictable. There were a few people, there's been a few, that have obviously bought into the mainstream media's idea that if we don't mask our kids, that there's going to be mass spread through our schools, and that the kids are going to pass it to each other, and then they're going to take it and pass it on to their teachers, or they're going to pass it on to their parents or their grandparents, and we're going to see people dying all over Twin Falls. And oh my gosh, it's been crazy. I've honestly been sitting here chuckling as I've been reading the messages, because boy, I mean, go ahead, pass the bread around, because the bologna's already gone around, you know? It's just been crazy to see how many people honestly believe that we're going to see massive amount of kids die, and we're going to see massive amount of parents and grandparents and people at home die. And whatever happened to free thinkers? Whatever happened to people who do research? Anyway, I'm not going to spend a lot of time on that. Let's talk about these masks for just a second, okay? There's already been randomized controlled trials done on the effectiveness of cloth masks, and not only the effectiveness of them, but some of the danger of wearing them. So one of these trials had over 1,600 people, healthcare workers, that they were studying. What they were trying to find out is that around the world there was a trend that healthcare workers were starting to wear cloth masks because they were more comfortable, and they were saying it was okay to do it, so they were doing it. And so there was a trial done to find out just A, how effective they really are, and B, to find out if there was any danger. Because obviously that's something that you should be concerned about. So when they do a randomized controlled trial, the reason that this is really the true scientific method, not just people taking a look at something like they're doing right now, because with coronavirus, they're just going, well, maybe we should try this and see what happens. Maybe we should try this and see what happens. Maybe we should watch and see what happens there. It's medical experimentation, folks. That's what this is called. Think back when everybody said that the correct procedure. Remember when they wanted to put ventilators in all the hospitals, and there was this panic that there wasn't enough ventilators. We got to get the ventilators out there. We got to get the ventilators at all the hospitals. Oh my God, there's not enough ventilators. Trump, please do something. You got to send ventilators to all the states. The governors are begging for ventilators. We don't have enough ventilators because that's what they were wanting to. The way that they thought that they needed to treat people who are at high risk, who went into the emergency room and they couldn't breathe, right? So we need ventilators. What did they find out? Does anybody remember? Does anybody out there, any of you who are freaking out right now, do you pay attention? They found out they were actually killing people. Like 100,000 plus people, if I recall correctly, that would possibly be alive today if they didn't ram these ventilators down their throats. So then they come back and say, no, we shouldn't use these ventilators. And now we got all these ventilators sitting in hospitals all around the nation not being used. Why? Because it's a novel virus. We don't know what works, what doesn't work. And that's exactly my point. And that's why they did these randomized controlled trials with the masks. And this is like, 10 years ago. And this isn't new science. This is something that everybody's known about. So they wanted to find out just exactly how effective they were and if they were dangerous. So a randomized control trial, back to that. Why do they do this? Because it's randomized, number one, which control group they're going to put you in. They don't say, okay, we want to put fat boy and all of you overweight people over here in this group, and then we're going to put all of the young healthy looking people over in this group, and then we're going to kind of tweak our control. It gives them, if you don't do a randomized control trial, it lends itself the possibility that the results will be tainted. Okay, so in a randomized control trial, they randomly put people in 3 control groups. One of those control groups wore the surgical masks, the customary ones that everybody was wearing before, and then over in this control group they put everybody that's wearing the cloth masks, and then over in this control group it was just business as usual. Okay, so that's the whole idea of a control. So they did this trial, and the results were very interesting. First of all, they found out that the cloth masks at slowing, at preventing anything from getting through, it was like, yeah, they were effective about 3%. Compared to approximately, I don't know the exact number, but it was in the range within a percent or two of about 65% effective with the typical surgical mask versus like, yeah, 3%, guys. Okay, we're having this argument over 3% effectiveness at controlling the spread of a virus. But what else they learned was very interesting. In the control group that was wearing the fabric cloth masks, they noticed a significant uptick in the amount of bronchial illnesses. Yeah. And you want your kids to wear these all day long? You think it's a good idea? Respiratory illness, let me back up. Bronchial, it can all be part of the same thing. But let's just, I want to make sure that I'm giving you good information. Respiratory illness. I'm correcting myself. Respiratory illness. They found a significant uptick in respiratory illness in the control group that was wearing the cloth masks. And you think it's a good idea that our Twin Falls School District Board of Trustees is mandating these things for your kids. It's medical experimentation. But outside of that, this whole idea that we're going to see mass spread in our schools is absolutely not true. The idea that we're going to see kids getting sick in huge numbers and dying is absolutely not true. The idea that we're going to see a bunch of kids carry home coronavirus and give it to their elderly and we're going to see all these old people die, absolutely not true. How can I say this? Well, I tell you what, I'm not going to answer this for you. I'm going to let one of our senators answer this because he already answered this. Senator Rand Paul did a good 5-minute plus speech on this. I'm going to give you about 4 minutes of that, which covers all of your concerns. So stay tuned for just a second. Watch this.
It's important to realize that if society meekly submits to an expert, and that expert is wrong, a great deal of harm may occur when we allow one man's policy or one group of small men and women to be foisted on an entire nation. Take, for example, government experts who continue to call for schools and daycare to stay closed, or that recommend restrictions that make it impossible for a school to function. For a time, there may not have been enough information about coronavirus in children, but now there is. There are examples from all across the United States and the world that show that young children rarely spread the virus. Let's start in Europe. 22 countries have reopened their schools and have seen no discernible increases in cases. These graphs behind me show no surge when schools open. The red line is where the schools opened. There is data from Austria, Belgium, Denmark, France, Germany, Netherlands. No spike when schools are opened. Contact tracing studies in China, Iceland, Britain, and the Netherlands failed to find a single case of child to adult infection. Here at home, child care for essential workers continued to be available in some states throughout the pandemic. Brown University researchers collected data on daycares that remained open during the pandemic. Over 25,000 kids in their study found that only 0.16% got COVID. And when you looked at the confirmed cases for staff, there was about 1% of more than 9,000 staff. The YMCA also has put forward statistics. 40,000 kids at 1,100 sites. There were no reports of coronavirus outbreaks or clusters. Dr. Joshua Sharfstein of Johns Hopkins writes, there is converging evidence that the coronavirus doesn't transmit among children like the flu, that it is a lower risk. Just yesterday, the American Academy of Pediatrics says we got to get kids back in school. We want them physically present in school. They even cite mounting evidence that children are less likely to contract the virus. Ultimately, this all comes down to the fatal conceit that central planners have enough knowledge somehow to tell a nation of 330 million people what they can and can't do. Perhaps our planners might think twice before they weigh in on every subject. Perhaps our government experts might hold their tongue before expressing the opinion whether we can play NFL football or Major League Baseball. Not in October. Perhaps our experts might think twice before telling the whole world that a COVID vaccine likely won't provide herd immunity. We don't know. Why weigh in with these opinions that we have no knowledge of? These are forecasts that may well be wrong. Perhaps our experts might consider the undue fear they are instilling in teachers who are now afraid to go back to work. No one knows the answers to these questions. We shouldn't presume that a group of experts somehow knows what's best for everyone. Hayek had it right. Only decentralized power and decision-making based on millions of individualized situations can arrive at what risks and behaviors each individual should choose. That's what America was founded on. Not a herd with a couple of people in Washington all telling us what to do and we like sheep blindly follow. This all begs the question, when are we going to tell the people the truth? That it's okay to take their kids back to school?
Can I just do something? Hold on a second. I think that about covers that.